Today we will be discussing the LAQ on principles and objectives of impression making. So let's begin our LAQ with the flowchart. Making a flowchart or even drawing a flowchart gives an impression to the examiner that the student knows the answer. So let us start with the flowchart of the objectives of impression making. There are 5 main factors which determine the objectives of the impression making, that is retention, stability, support, preservation of the residual structures, and aesthetics. There are 5 subtopics in retention that determine the retention of the impression. One is anatomical, physiological, physical, mechanical factors, and muscular. Anatomical factor consists of size of the denture bearing area and tissue displaceability. Then is the physiological factors. Physical factors, there is a short mnemonic for the physical factors, that is cohesion, adhesion, capillarity, atmospheric pressure, interfacial surface tension, and gravity. Mechanical factor consists of undercuts, denture adhesives, suction chamber and discs, and muscular. Then we move on to stability. A short mnemonic for stability is QV. C stands for contour of polished surface. O stands for occlusion plane. A for adaptation of denture to the tissues. T for teeth arrangement. Q and V stands for quality of the soft tissue covering ridge, and V stands for vertical height of the residual ridge. Then comes the support, preservation of the residual structures, and aesthetics. So after drawing the flowchart, a very important point to remember is to write definition. Examiners love definition. So in this answer, the main definition is of impression, that is a negative likeliness or copy in reverse of the surface of an object and imprint of the teeth and adjacent structures for use in dentistry. Do remember to mention GPT-8. Next, we move on to principles and objectives of impression making, the main answer of this question. So begin with writing the principles. There are 8 main principles of objective making. 1 is tissue must be healthy before impression making. The keyword over here is healthy. Next, proper space must be provided for selected impression material. Keyword over here is proper space. Third, tray and impression material should be dimensionally stable. Over here, the main keyword is dimensionally stable. Fourth, for correct positioning of tray, a guiding mechanism should be provided. Guiding mechanism is your keyword. Impression should be adequately extended to include the entire basal seat areas as dictated by limiting and supporting structures. Over here, the main point to be remembered is adequately extended. Sixth, a border molding must be performed in harmony with anatomical and physiological limitations of the oral structures. Border molding is important in this point. 7th, impression must be removed without damage to the oral structure. The keyword over here is removed without damage. 8th, the tissue surface of impression and intaglio surface of the denture must coincide. So the key point over here is the tissue surface of the impression. So to remember the principles of the impression making, just try to remember the keywords, that is healthy, proper space, dimensionally stable, guiding mechanism, adequately extended, border molding, removed without damage, and the tissue surface of the impression. So these are the main keywords in this answer. To begin with, it is very easy to remember. If a tissue is healthy, then there will be proper space that you can provide to the healthy tissue for selecting the impression material. The impression material, if you are selecting, should be dimensionally stable. If all the 3 points match, that is the tissue is healthy, proper space is given, and the impression material is dimensionally stable, then next is the correct positioning of the tray. If you don't position the tray correctly, the impression will not be recorded nicely. 5th, everything is done in a proper manner, then the impression should be extended adequately, like the material should flow in all the denture bearing areas. 6th, border molding must be done so that all the denture bearing areas are recorded. And then remove the impression without damage. If you are taking impression and removing it when the material of the impression has not set, it will cause damage. And last is the tissue surface of the impression should record all the structures. As we have already discussed the objectives of the impression making through a flowchart, Next is to write the objectives in a proper manner. So first is the retention. Always remember, don't forget to write the definition. So retention, that quality inherent in the dental prosthesis acting to resist the forces of dislodgement along the path of placement. You have to learn and by heart this definition. Next, you can skip the 2 points. Next, directly start writing the factors affecting retention. As we said, anatomical factors, as we have discussed earlier, anatomical factors again have 5 to 6 main subpoints. So first is the size of the denture bearing areas. Retention increases with increase in size of the denture bearing area. The average size of the maxillary denture bearing area is 24 cm square and that of the mandibular denture bearing area is 14 cm square. So the main point to be remembered in the denture bearing area is retention increases with size. That is the main point. Next main point is to mention the average diameter of maxillary and mandibular denture. Then we move to the tissue displaceability. The displaceability of the tissue affects the retention of the denture. Tissues displaced during impression making will rebound during the function and lead to loss of retention. This is very similar to one of the principles of the impression making. Next comes the physiological factors. So the physiological factors depends on what? The amount and consistency of the saliva. It is very easy to remember. If thin and watery saliva is there, it will give you the best retention. Excessive saliva, that is thick and ropey, accumulates between the tissue surface, and absence of saliva affects the retention. So the main point to remember in the physiological factors is nothing but only saliva. So what are the main points? The amount and consistency of the saliva affects retention. Thin saliva offers best retention. Thick saliva does not offer best retention. Absence of saliva will affect the retention. So that is all about physiological factors. Next comes the physical factors. So physical factors, the mnemonic that we had remembered earlier is CACAIG. So first is adhesion. Adhesion is defined as the physical attraction of unlike molecules to one another. Definition, once again, very important. Saliva is present in between the denture base and the mucosa, and its contact with both these surfaces creates adhesion. Same, the physiological factor. Then you have to write on what factors the adhesion depend. It depends on close adaptation of denture, size of the denture bearing area, and type of saliva. Again, these two are very similar to the principles of impression making, and type of saliva is nothing but the physiological factor. Then you have to write adhesion also takes place directly between the denture base and mucosa in case of xerostomia, that is lack of saliva, but this leads to ulceration and abrasions in mucosa. Not very important point. You can draw the diagram of the adhesion, that is this diagram over here, that will fetch you more marks. So in adhesion, you have to remember one is the definition. Second is saliva is present between the denture base and the mucosa, and its contact with both these surfaces creates adhesion. So if saliva is present, so by logic, there are 3 factors on which adhesion will depend. One is close adaptation of denture, size of the denture bearing area, and type of saliva. Next we move on to is cohesion. So cohesion is defined as a physical attraction of like molecules to one another. Adhesion is physical attraction of unlike molecules. Cohesion is the physical attraction of like molecules to one another. This occurs with the film of saliva and it aids in retention. Again, in adhesion and cohesion, the important keyword is saliva. Normal saliva is not very cohesive, hence retention from mucosa interface is more dependent on adhesion and surface tension. As viscosity of saliva increases, this point is important, greater is the cohesion, but very thick mucous saliva can physically push the denture out, resulting in loss of retention. So as you have noticed, the points in adhesion and cohesion are very similar. You just have to mention the definition of the same, of both adhesion and cohesion, and write about saliva. You can also draw the diagram of cohesion, which will help you. So it is nothing like it is just the opposite diagram of what we had seen in adhesion. So in adhesion, we can see there is a denture base, saliva, and mucosa. So these two are unlike particles that are attracting to each other. In cohesion, we can see saliva and saliva. These two are the like particles that are attracting to each another. Third is interfacial surface tension. Once again, definition is very important. Interfacial surface tension is defined as the tension or resistance to separation possessed by a film of liquid between two well-adapted parallel surfaces. It is dependent on the ability of the liquid to wet the surface. This point is the key point in interfacial surface tension. After that, you can just mention the formula, that is F, that is the force, is equal to 4.7 into K r power 4 by H cube into V. And just mention what is F. F is nothing but the surface tension. K is the viscosity of the liquid. R is the radius of the contacting surfaces. V is the velocity of force. H is the space between the surfaces. And then you can explain that greater the space, as this is inversely proportional, interfacial surface tension is less. Like if there is more space present, there will not be much of interfacial surface tension. So you just have to learn this formula, explain the formula, like what factors are directly proportional and which factors are inversely proportional. So till now, we have studied three main, that is adhesion, cohesion and interfacial surface tension. In adhesion and cohesion, write the definition and explain in regards to saliva. In interfacial surface tension, the main key point over here is one, that is to wet the surface, the definition of the same, and write the formula. And no need to draw this diagram, but definitely you can draw this diagram, it will fetch you more marks. Next comes the capillarity, that quality or state which because of surface tension causes elevation or depression of the surface of a liquid that is in contact with the solid. So definition once again very important. Capillarity causes the thin film of saliva to rise and increase its contact with the denture base and mucosa. Close adaptation of the denture base to the mucosa is important for capillarity to provide effective retention. So over here, the 2 points which is important is one is the definition, second is capillarity causes the thin film of saliva to rise and increase its contact with the denture base and mucosa. Next is the atmospheric pressure. What is atmospheric pressure? Nothing, but this can help resist dislodging forces if the denture have an effective border seal. Peripheral seal or border seal is defined as the contact of the denture border with the underlying or the adjacent tissues to prevent the passage of air or other substances. That's why we do border molding, so that we have a proper peripheral seal. When a force is exerted perpendicular to and away from the basal seat of denture, which is properly extended and fully seated, pressure between the prosthesis and mucosa drops below the ambient pressure, resisting displacement. This has been previously referred to as suction. So you can draw this diagram. Draw two teeth, show the forces that are acting downwards, and just write, when dislodging forces act on a properly extended denture, pressure between the prosthesis and the mucosa drops, contributing to retention. So if there is no proper peripheral seal, or if you commit any mistake during the border molding, then you will find that patients are not happy with the dentures, as the denture just keeps on falling. Retention due to atmospheric pressure is proportional to the denture base area. Once again, this is a point of the principles of impression making. So, in your atmospheric pressure, first you have to mention the definition. Second, you can draw the diagram. Third, you can write retention due to atmospheric pressure is proportional to the denture base area. And then you can add proper border molding is essential for the retention mechanism to function, and draw the diagram. Drawing diagram in your exam helps you to elongate your answers and give examiner the confidence that you people know the topic. Then is gravity. Very easy. This natural force can aid in the retention of the mandibular denture, especially when there is more weight and other retentive forces and factors are marginal. So retention of the mandibular denture is more important for gravity. Gravitational force helps seat the mandibular denture while it acts against the maxillary. Obviously, gravity will act against the maxillary denture, but it will help in seating of the mandibular denture. So you can draw this diagram. So in gravity, only word key point is mandibular denture and aid in the retention of the mandibular denture. And then we move on to mechanical factors. So mechanical factors, first point that is important in mechanical factors is undercuts. Moderate undercuts enhance retention because of the resiliency of mucosa. Example are unilateral tuberosity undercuts in maxillary premolar area, distrolingual areas and lingual to the midline of mandible. Severe undercuts covered with thin mucosa compromise retention. So in undercuts, moderate undercuts enhances retention, and one example that you can learn is unilateral tuberosity undercuts. Severe undercuts compromise the retention and it needs to be surgically eliminated. Undercuts like those present in the retromolar areas, maxillary anterior ridge allow insertion of the denture with a rotational path with undercut area seated first. They provide good resistance to displacement in vertical direction. Good resistance to displacement in vertical direction. So in mechanical factors, first is undercuts. Undercuts you have to learn 2 points. Moderate undercuts, good retention because of the resiliency of the mucosa. One example that is unilateral tuberosity undercuts. Next is severe undercuts, compromise retention and that needs to be surgically eliminated. Next is denture adhesives. These commercially available products enhance the retention. So denture adhesive, what we give to our patients, so it will increase the retention by increasing the adhesive and the cohesive properties. Then come the suction chamber and disc. So you can draw this diagram like make a maxillary denture and then a suction disc and explain. These have been used to create a negative pressure in the palatal surface of the maxillary denture, thereby enhancing retention. So in mechanical factors 3, undercuts, denture adhesive, suction chambers and disc. Undercuts, moderate undercuts enhance the retention. Severe undercuts compromise the retention. Denture adhesive enhances the retention. Mainly people use it for the maxillary denture. Then comes suction chamber and disc. Then comes the muscular factors, which is the last factor in your retention. The oral and the facial musculature and tongue play supplementary retentive forces. Teeth must be positioned in the neutral zone between the tongue and the cheeks. Important. Polished surfaces of the denture should be properly contoured. Denture base must be extended to cover maximum area. Occlusal plane must be at correct level. Potential denture space or the neutral zone is explained later on. No need of this point. So in muscular factors, what you have to remember by logic, muscular factors means your muscles and the tongues that help for the retention. So how will this take place? If the denture surface is not polished, or the denture surface is extended, or occlusal plane is not correct, there won't be any retention. So these points are indirectly nothing but the principles of the impression making. That's why it is very important to by heart the principles of impression making so that you can include those points in your subtopics. Next is the stability. Very important. So we are done with retention. Now we are moving to stability. Very important is the definition of the stability, the quality of a removable denture prosthesis to be firm, steady or constant, to resist displacement by functional horizontal or rotational stresses. Now what are the factors? We had remembered a mnemonic, that is quote CQV. So let us start. First is the vertical height of the residual ridge. Stability decreases with the loss of the vertical height of the ridge. You can draw this diagram. See, A, good ridge with proper height. So stability is good. Poor ridge height. And C, we can see there is a flabby ridge. So if the ridge is good, the denture will seat properly. So vertical height is important. Quality of the soft tissue. Flabby ridges provide poor stability. So it is one main subtopic with one main word that you have to mention. Vertical height of the residual ridge, you have to remember, decrease with the loss of the vertical height of the ridge. Quality, you have to remember the word flabby ridge. Adaptation of the denture to the tissue. Very logical reasoning to this. Close adaptation of the denture to the basal seat tissue is very important to ensure proper stability. So it is like just write this main subtopic, that is adaptation of the denture to the tissues. Next is the occlusal plane. The occlusal plane should be oriented parallel to the ridges and should divide the interarch space equally. Important. Inclined occlusal planes will promote sliding forces. So you can draw this diagram like make a mandibular denture, maxillary denture, and just show that it contributes to the stability, interarch stability, and it should be divided equally. Then comes the teeth arrangement. Setting teeth in balanced occlusal and neutral zone promotes stability. So you can connect these points to the mechanical factors of the retention. And then is a contour of the polished surface. The polished denture surface should be in harmony and with the functioning of the oral mucosa. So in stability, one is the vertical height that you have to remember. Then comes the quality of the soft tissues, adaptation of the denture to the soft tissues, occlusal plane, teeth arrangement and contour. So you can see that mainly all these topics are moving in and around the principles of impression making. Next is the support. We started with retention, stability, and now we are moving on to support. Definition, very important. The resistance to the vertical forces of mastication, occlusal forces and other forces applied in a direction towards the basal seat area. To provide adequate support, the denture base should cover as much denture bearing area as possible. This is known as snowshoe effect. So you have to write the definition. Draw the diagram of the snowshoe effect. So you can see this, they have shown two teeth and maximum denture bearing area as much as possible. So forces are distributed equally. Forces are distributed equally in all the directions. The maxillary and mandibular supporting structure and stress bearing areas are discussed further. So you can just mention that the maxillary and the mandibular supporting structures, they aid in support of the denture. Then is the preservation of the residual structures. Preservation of the remaining oral structure is vitally important to long-term success of the denture. Accurate impression using a selective impression technique that places pressure only on stress-bearing area is important. So preservation of the residual structure, one important is the selective pressure impression technique is what you have to mention, so that the other structures are relieved. That is prevention of the residual structures. Last is aesthetics. Denture border and flange thicknesses are dependent on the amount of the residual ridge loss, and it varies with each patient. Reducing or increasing the thickness of this area leads to poor aesthetics. Bottom holding ensures adequate thickness. Once again, we are moving in and around the principles. So in aesthetics, you have to remember denture border and flange thickness are dependent on the amount of the residual ridge loss and varies with each patient. So with this, we complete the LAQ on the impression making objectives and principles. So to begin with LAQ, first draw the flow chart, then write the definition of impression, which is very important. Learn all the principles because all the subtopics of the objectives are indirectly related to principles of impression making. Start with retention, the definition of retention. Write all the factors affecting retention with the proper keywords. Remember, physiological factors has saliva, physical factors, the mnemonic CACAIG. Once again, draw both the diagrams of adhesion and cohesion. Then we move on to interfacial surface tension, the definition and the main formula. Explain the formula, like which factors are directly related to the surface tension, which factors are indirectly related to the surface tension. Draw the diagram of the surface tension. Next is capillarity, the definition of the capillarity. Then comes atmospheric pressure. Draw the diagram of the atmospheric pressure and explain the main keywords in the atmospheric pressure. Next is the gravity, very important, mainly in the mandibular denture. Draw the diagram. Then we move on to the mechanical factors, undercuts, explain about the moderate undercuts, severe undercuts. Then denture adhesives, draw diagram as much as possible. You can just draw a maxillary denture and shade with pencil the surface of the maxillary denture, showing this as the denture adhesive. Then comes suction chamber and discs. Then we move on to the muscular factors. Muscular factors are nothing but your principles of impression making. Next is the stability. Once again, definition of the stability, factors affecting stability, vertical height of the ridge, quality of the soft tissue is nothing but the flabby ridges. In vertical height of the ridge, you can draw the diagram A and diagram C. Then we move on to the adaptation of denture to the tissues, occlusal plane. Once again, draw a diagram showing equally divided interact spaces that contributes to the stability. Teeth arrangement, once again, balanced occlusion is your keyword. Contour of the polished surface. Next is support. explain about the snowshoe effect, draw the diagram of snowshoe effect, and then write the definition of support. Preservation of your residual structures. Very important is the selective pressure technique. If you don't preserve the residual structures, the patient will have pain in future while placing the denture. Next is the aesthetics. Aesthetics is nothing but you have to mention about border molding. Reducing or increasing the thickness of the area will lead to poor aesthetics, and denture border and flange. With this, we complete our LAQ on the objectives and principles of impression making. Yeah, so thank you.